can relate to it all. So
Okay,
yeah, I
I'll go
will.
ahead and record it.
Thank you very much, and I'll turn the camera off now, and then as soon as we get to my appointment, John will be on. So
Okay,
thank you so much, guys.
you bet. So Blake,
Yes.
where do you want to start?
Well, I'll just give you an incredibly brief version of my medical history. Yeah, I'm 41 years old. I got Epstein-Barr mono when I was 20, which triggered chronic fatigue. Then when I was about 29, I lived in a moldy home, and that triggered mast cell activation syndrome and POTS dysautonomia. And more recently, a neuroquant brain MRI showed that I have a swollen, inflamed brain, was in the 96th percentile, and my particularly swelling and inflammation in the brainstem and thalamus. So my two biggest issues I'd love your advice on is the mast cell activation and then the brain inflammation.
Okay, so the mast cell activation, that's very clearly amenable to a number of different therapies that haven't been really discussed very often. Number one is the beta-Caryophyllene. Beta-Caryophyllene has very specific actions on the mast cell to inhibit their actual release of histamine and the inflammatory cytokines that go along with it. So it blocks all those pathways. I have even seen it inhibit anaphylactic reactions in three cases. So it's an impressive result, but I really can't get anybody interested in it. Everybody wants to go with standard therapy, which is horrible and it's incomplete. And so I don't understand what it is. I put myself out there to a major authority, a Dr. Afrin in Massachusetts, and he said, you got to have clinical studies. He won't even look at me. He won't even talk to me until I have a clinical study of, umpteen number of patients, human patients who've tested it. Even though I've had many anecdotal cases, I haven't got any clinical, human clinical cases to test. So it's unfortunate, and I can't get any advantages that way. Now, the other substance that is remarkable that could have a role for you is palmitoyl ethanolamide. That's PEA. Have you heard of that before?
Yeah, I've heard of that before. Yeah. Yes.
Okay. So I use that daily just because I'm really into endocannabinoids, and I use it as a benefit. I don't have anything specific except I have a considerable amount of off and on pain, mechanical pain, and arthritic type of not arthritis, just mechanical pain from some issues that I've had. So I use that on a regular basis, and I take about 2 of the capsules, just once a day, but you can take it 4, 6 or more times a day. Well, you can take it 2 capsules twice a day. That's what I was doing for a while. But that seems to there's a lot of good literature support for the use of PEA. And I don't know if that's something you consider trying, but that's an option for you.
So I forget how to pronounce it, but with the beta-Caryophyllene, you use the liposomal product as being the best product? Okay.
Yes, but yes, I do. I use a liposomal form, which really amplifies the effects of of a small amount of the BCP. We'll call it BCP now. A small amount of BCP in order of between 15 and 30 milligrams is the equivalent of taking 300 milligrams of the raw caryophyllene that you might get from a wholesome source, a whole food source.
Okay. One question that sounds amazing. I tend to react to a lot of things taken orally. Is this something that is bioavailable nebulized?
Yes, it can be. In fact, I first learned about some of the powerful benefits of Caryophyllene as a result of nebulization. I gave it to a patient to put on topically. She put it in a vape pen and she vaped it. She had a good result. I transferred that information to a patient who was having a diabetic retinopathy and macular degeneration, and it reversed his disease. So then I knew it was highly effective in inflammatory conditions, and I was using it as a vape. But then there's been a real souring of the vape methods and the information about vaping, and so we've stopped producing any vape product. I did have a specific Caryophyllene vape at one time, but I've dropped that because of the current climate.
So, but can you put the liposomal BCP in the vape pen?
No, you don't put that in. You put the pure oil. You put a 95% or 91% pure Caryophyllene in the oil, Caryophyllene in the chamber, and you can vape that. You can also dilute it in. You can dilute it in. I've forgotten what the dilution material is, but it can be diluted and it's safe. It hasn't caused any problems in anybody. It's actually been tested as a vaporizing product in specific animals. It was tested in rats, and it was tested for aortic damages that were occurring in the animals. And so they vaped the Caryophyllene, and the Caryophyllene was deposited in the aorta and it prevented the damage. But the remarkable thing was it actually was deposited in the aorta. So that added to the benefits that were going on with it.
Yeah, it's incredible. And it can be used if you use the liposomal topically, that has a systemic effect. Yeah,
so now we're talking about we switched from using the pure form, the 91%, over to the liposomal form. And the liposomal form is oral or topical. It can be used either way. Now, the liposomal form seems to be enhance the absorption through the skin as well as through the mucous membranes. And so I've used it a number of times. And what I have people do if they are having a nasal congestion or nasal allergies, is put a couple drops on the bridge of their nose, and it'll clear up their sinuses within 10 minutes.
Okay, it's amazing. My friend Linda has such severe mast cell problems that she gets a burning tongue from foods. Could she just hold it in her mouth for 10 minutes and jiggle it around or something like that?
Well, she only needs to put it in her mouth for a minute and it'll take care of it.
Just a minute.
Okay. Yeah, that's my typical directions is sublingual dosing. So you take a 1 milliliter. It all depends. I say 1 milliliter. That's kind of a standard dose. But for you guys who are extremely sensitive to things, you're going to want to start off very, very slow. You're going to want to start off with 5 or 10 drops if you're going to use this product. So 5 or 10 drops. And you're going to self-assess yourself within 10 minutes afterwards. And then you'll hold it in your mouth for 1 minute, and then you can swallow it. So for you, again, for mast cell sufferers, then you're going to be very cautious. So I have directions for you to use it topically first as a single drop, and to verify you're not going to get any reactions. I've never seen a reaction. I've never seen anybody react to it, but I know that you are extremely cautious people. So you can put a drop on your skin, notice if there's anything going to happen, and then you can put 2 or 4 or 5 drops on your skin. And I tell people to rub their backs of their hands together so their fingers are clean, and then they can assess the impact of the Caryophyllene. And then they can start with an oral dose. The liposomal is water soluble, so you can put as many drops in water as you want, or you can put it directly in your mouth. Now, I prefer to have it directly in the mouth, but I realize that there's some sensitivity issues and you may want to dilute it first. to verify that you're going to be able to tolerate it okay.
Mm-hmm.
And
Okay,
then,
great.
then the dosing is, I generally recommend twice a day, but for mast cell activation, it's about a 4 to 6 hour window of reduction in mast cell activity. So you may have to do it more frequently in small amounts in order to get that level of suppression of the mast cell activation. Now, over time, I believe it's going to correct the mast cells and the reactions that you do get. So I think that over time that you'll improve your reactivity, and even I think actually resolve your reactivity for the most part, because I've had patients who have reported that they've controlled their asthma, they've controlled their reactivity, they're just taking a modest dose on a regular basis, and they're not having any problems.
Sure. Yeah, sounds great. So what would be the full daily dose of the liposomal product?
There's no limit. It's FDA approved. It's been tested in animals at huge doses, no toxicity. Absolutely no toxicity occurs. There's no drug interactions either. So, and it's got the approval by the FDA and the European Food Safety Authority. And I've never seen any kind of reaction to the product. So I think you're awfully safe in using it.
Okay, so if someone was,
what I mean is, what I meant to say is there's no limit to how much you can use. Generally, people are taking in anywhere between 5 drops on a single day basis to 2 milliliters 4 times a day. And that's the variations that I see.
okay, so if someone with mast cell issues was doing, say, 4 doses a day, what would be a fairly good therapeutic dose for each of those 4 doses?
A half a milliliter. A half a milliliter is 15 drops, and every drop is 1 milligram.
Okay, got it. And if I was to nebulize the pure 91% oil, what would be a...
Well, I would put it in water. I would put it in, I would put a milliliter into 4 milliliters of saline water and then nebulize that. And I think that has worked quite well in one patient.
Yeah. And you would potentially do that 4 times a day?
Right.
Okay. Okay, got it. Okay, great. That sounds excellent. Thank you. So tell me again about sinusitis. Linda, John, and I, we all have like a mast cell sinus issues. You mentioned the liposomal product.
So I think that the oral product will work very effectively, but if you have sinus issues, then you can put it on your nose and on your face, and you're going to get significant relaxation of the airways, and you're going to get mobilization of the fluids in the airways. And because it's going to open up the air passages, you're going to get a lot more movement of your air in circulation, and you're going to reduce inflammation tremendously with it.
Okay. So just to clarify, you're using the liposomal product for the...
Well, you can use that, or you can use a gel product that we have. A gel product has got about the same concentration. It comes in a base that is a very, very standard formula that has been used for skincare for 30 or 40 years. It's dimethylamino ethanol. It actually reinforces skin texture. It resolves wrinkling, and it restores collagen. So we've combined that with a couple terpenes, including the beta-Caryophyllene, that work on the cannabinoid type 2 receptors, and they provide enormous amount of pain relief, but anti-inflammatory relief as well. And they actually have been effective for migraine headaches and neuropathies. So that comes in a small gel. We have 2 forms of the gel. We have it in a large bottle, 4 ounces, and we have small sample bottles that are sample jars that are in 7 milliliter, that I generally I will send out as a sample for people to test and see if they like it and they want to continue it, because it's got such a high price point on it.
Oh, excellent. Before we move on to another topic, my friend, hopefully the products you described will have a big impact on this, but my friend Linda has quite severe interstitial cystitis, which seems to be related to mast cells in the bladder. Would you'd think just, the oral and topical forms would be enough, or is there some kind of bladder administration, or rub it over the bladder or anything like that?
I think the oral administration is going to be adequate for her. She might have to get up to a higher dosage. She can also put it on topically around the bladder area, but we have talked about developing some suppositories, but we're not quite there yet. I mean, it could be put into a suppository form. It could be well absorbed in that way.
Okay, interesting.
So I would say that if the oral approach does not work and the topical approach is not effective, that she could go on to using we could talk about a suppository if that were arrangement.
Okay, great. So yeah, thank you. So the other issue I really wanted to get your opinion of is the neuroinflammation issue I have.
The neuroinflammation. Yeah, this is fabulous for neuroinflammation. I mean, I've written a paper on it about neuroinflammatory and neurodegradation types of diseases. It hits all of the targets that control inflammation in the brain. And there's at least I think there's about 20 different mechanisms that are at play, and BCP hits it all.
Yeah. Wow. So
now BCP
so really you're finding BCP. Sorry, you finished.
BCP has been effective in animals. There's only 10 human studies with BCP, unfortunately. So we don't have a lot of evidence. I don't know why there hasn't been any investigation, probably because it's so widely available. Nobody wants to invest the money into developing a unique product for it. But there's 3,000 studies of beta-caryophyllene in PubMed, and so many of those studies are across the board, and they really deal with inflammatory conditions, and particularly neuroinflammation. They deal with ischemic type of injuries to the brain. They deal with misfolding of proteins. They deal with infections. They deal with also Alzheimer's disease, Parkinson's, also diabetes, and Huntington's, chorea. They deal with all diseases of the brain, and they all come up ACEs in terms of the response to BCP, but we haven't studied it in humans.
It's incredible. So again, with the neuroinflammation, we're talking about the liposomal BCP would probably be the best product, correct?
Right.
Okay.
Now, the gentleman I was treated with the eye, I treated him with a vaporizer, and he was vaping that, and he got really good response, and he resolved his eye inflammation. But it was only when we switched to the oral form that he completely resolved his problems. So that's why I think that the oral form is going to be the very best. The vape is a very good technique for getting it right directly to the eye and to the brain, and immediately accessing it. But the liposomal is so fast, and in terms of its penetration, you get results within 10 minutes. You will see significant improvements within 10 minutes of use.
Incredible. That is incredible. This question is actually from my mom, who's 70 years old. What's a good product for insomnia? She tends to have trouble falling asleep and will often wake up at 4:30 in the morning, way too early.
Well, beta-caryophyllene is actually superb for helping people sleep. Typically, I put people on it, and I ask them the next day how they've done. and they all report one of the best sleeps that they've ever had. And I know myself that I use it, and I get up to 30% deep sleep when I take beta-caryophyllene after a night.
So you would just take, say, half a meal before bed.
Right.
Okay.
But you have to be careful about taking it before bed. You know, beta-caryophyllene is paradoxic in that it helps you relax. It puts you in a parasympathetic mode so that you're relaxed, you're digesting, you're comfortable, your mood is elevated. You have feelings of well-being. You've got a great deal of comfort. The pain is relieved, but it's also activating. Your brain gets into an active, a logical sequence. You get task-oriented. You want to get things done. You want to take part in things. And so that activity can delay your sleep onset. And so I have people, I said, yeah, you might want to not take it right before bed until you know that it doesn't activate you to that degree. And then if you learn that it's okay, then you can take it at nighttime.
Okay, got it. Interesting, very interesting. What about tinnitus? Have you had much experience with that?
No, I had a couple of patients with tinnitus. I've had a good response, a couple of good responses with it. It hasn't eliminated the tinnitus, but it has greatly decreased it, and it's in a more comfortable level that they can tolerate it. Now, everything that I've read about tinnitus is that it is a hyperinsulinemia phenomena that occurs, but I'm not sure that I buy that completely. I've had people, I've directed people in all cases, I direct them to use a ketogenic diet. So I'm a real ketone phenomenal. And I'm really big on ketones because of the major signaling properties. It turns out that BCP signals in all the way that ketones do in our body. And do you understand about the ketogenic diet?
Yes.
So all the ways that intermittent fasting and a ketogenic diet generate ketones in the body, and those ketones are not only substrates for metabolism and for energy, they are also signaling molecules that stimulate the mitochondria in a number of different ways. And they are anti-inflammatory, very specifically. So I always tell people that most of the time, especially with brain inflammation, you should be on a ketogenic diet for sure.
Great. So coming back to something you said before. So when you use the liposomal BCP topically, where are you typically applying it on the body?
Well, you can apply it over an area that's sensitive, or you can apply it to the back of the hands. Now, a lot of people talk about putting it on the back of the neck. They put it on their temples, and they put it around their umbilicus. I've heard of all different methodologies. I don't know about those things, and I think they could work, but I haven't documented any particular benefits in that particular technique.
So just the back of your hands should have some systemic absorption.
Right, it does, guaranteed.
Okay, so I might start with the topical and the nebulized, and then once my body has calmed down somewhat, I could introduce the oral. So over time, I think the nebulized and topical probably the best place for me to start, given my sensitivity to reacting to things orally.
I've got the case report of a gentleman who went through that methodology that I was telling you about. He was sensitive. He was extremely sensitive and very cautious, and so he incremented up from a topical to an oral dosing. And so I've given that to you in the chat section.
Oh, great, thank you. Excellent. I see that. Let's download that now. Yeah, that sounds perfect. I was thinking if there was any other questions. So it's good for BCP is also good for osteoarthritis.
Yes, it's magnificent for arthritis of any kind.
Great.
Because it inhibits the immune cell reactivity. So every one of our immune cells has got a CB2 receptor on it. And beta-caryophyllene is a very specific and strong agonist for the CB2 receptor, and it activates it, and it switches the immune cell from the reactive phase over to the monitoring phase, the resolution phase. So it's going from active to resolution. And that's where you want to be. You don't want to turn off your immunity. You want to switch it to the monitoring phase, and so that it can resolve the inflammation that's been there before. It also prevents the invasion and the migration of macrophages, and so the cell type is, you're not going to get invasion of the macrophages. Plus, on osteoarthritis, interestingly, osteoarthritis has a lot to do with neuroinflammation, and the spinal cord has a lot to do with it. And beta-caryophyllene actually modulates the dorsal nerve that controls a lot of that inflammatory signaling that goes on with it. So you've got a multitude of different mechanisms that are at play with osteoarthritis, but then you get rheumatoid arthritis and psoriatic arthritis, and that stops tumor necrosis factor and all the inflammatory cytokines that are released by mast cells as a result of the immunologic phenomena that's going on.
Great, wonderful. I've already asked you this, but if someone was to use the liposomal BCP topically, are they still using the same dose they take orally, like 0.5 ml, say up to 4 times a day?
Yeah, I would recommend it. So if you get a burn, a bite, a sting, or an abrasion, you can put the BCP on that area and it'll calm down the pain, but you still take your oral dosage if you need it. Now, I'm not saying that you have to have it, but if in a problem, you need to adjust the dosage according to your need. And that's what I tell people, rather than giving them a specific dosage to use, that I want them to base it on their performance level. So if your performance level is great on 3 milliliters a day, fine, keep it up. On the other hand, if you're not getting any particular added benefit from taking it, then cut back. That's fine. So there's specific benefits in visual acuity with mental and visual focus, in mood, and in anti-anxiety, anti-depressive effects. And so you want to maximize those particular effects for your improvement. And if you do that for a period of time, then you may be able to reduce the dosage with time, and along with other lifestyle changes you can now incorporate into your lifestyle, since you've been relieved of a lot of the risk factors for exposures.
Yeah, that's wonderful. Thank you so much. We're almost out of time. Linda and John, we've only got a few minutes left, but if there's any burning questions that we haven't covered, you could jump in now and ask them. I think
we got plenty of time.
Got plenty of time? Great.
Oh, yeah, hi, Blake. Thanks very much. I think Linda had one question, which was that she reacts when she takes THC cannabis oil, and she was wondering if she vaped it, whether that might help her tolerate it.
Vaped.
Sorry,
BCP.
I think did you get that or not?
Yeah, I did.
I'm not sure the full. Yeah, okay.
I do seem to tolerate full spectrum hemp oil through my tiny minimal amounts of BC. Can't get it all out. Has CBD and other things. Only if you have time to answer the question, though. I'm not sure what the question is. Now, one of the things that BCP is actually in hemp, in a good quality hemp, you're getting some BCP, but you're not getting the levels that we're talking about, that I'm talking about, that you need quite a significant concentration of caryophyllene. So the caryophyllene I generally use about 15%. And you can get that from a pure oil, and you can put that into a vaporizer, and you can probably get some benefits from that. But if and so I'm wondering if you're talking about that type of vape with THC, beta-caryophyllene, and CBD.
Yes, I think so. So basically, she used to take the oil, and then she started reacting to the oil, and yeah,
CBD,
and so
CBD oil.
Cannabis oil with THC.
Yeah.
Okay.
So she can tolerate CBD oil, okay, but seems to react to the THC. So I guess she was wondering, if she vaped the THC as well with the oil, might that enable her to tolerate the THC too?
You could with time. Now, one of the things that we have noticed is that accelerates the high effect from THC by using beta-caryophyllene. Beta-caryophyllene inhibits the degradation enzymes for THC, so it raises the levels and it maintains them at a higher level. So typically, if a person is using THC, they reduce their dosage by about 30 to 40%.
Wow.
So basically, for every question I've asked you, you've recommended the BCP rather than CBD oil. It sounds like the BCP is significantly more effective than just a regular CBD
I believe
oil.
it is. I believe that's true. In fact, all of the studies on beta-caryophyllene have been marginal in terms of all the studies on cannabidiol have been marginal in terms of when it's isolated and when the benefits. Does it relieve pain? Does it provide any cognitive benefit? Does it has any mental health recommendations? And these are all equivocal studies. But when we use full spectrum cannabis, we always get a good response. I've been in the business for over 8 years, and I know that a full spectrum gives the maximum results. And yet I see all these reports of these CBDs that are being used that are getting these marginal responses, and I can't understand that. The only way I can explain it is if the full spectrum contains significant amount of terpenes like BCP, then they're going to get the benefits of the full entourage. And I think that BCP is one of the primary terpenes that has this entourage effect. And I've seen it, and I can just about verify that every benefit from cannabis can come from beta-caryophyllene.
Interesting.
Wow.
Yeah.
Mm-hmm.
Yeah, and I think John,
Except the high. You tend not to get high.
Yeah.
Now, you do have feelings of well-being. You have relaxation and well-being and confidence, but it's a totally rational approach, and there's no hallucinations with it. You can have vivid dreams, and some people don't like that vividness of their dreams, but it's a bit of a hassle. I tell people about it, not to worry about it if they can get past it.
Yeah. Well, I think, John, if Linda tried the oral and she had a mast cell reaction to the oral, she could just try the nebulized or the transdermal and maybe come back to the oral at a later date, which is basically what I'm planning to do anyway.
Yes.
So, because I think part of Linda's problem is that the mast cells in her gut seem to react to a lot of things she puts in her mouth. Yeah. So if she could bypass the gut, does that seem logical, Dr. Blake?
That's very practical and very logical.
Yeah. So
yeah.
That sounds good. Sounds good. Well, I think we pretty much covered everything I wanted to.
Now, I want to tell you about something else. And I told you about the effects on mitochondria. Well, it also suppresses the appetite. And it because it activates the mitochondria, it changes the metabolism of the body and accelerates fat loss. It accelerates fat loss from visceral fat in particular, but it actually strengthens muscles in particular. So you get muscle gain with fat loss, and it's typically a visceral fat. So I've had people lose on the order of 12 to 15 pounds within about 2 weeks of use of beta-caryophyllene.
It's amazing. It's amazing.
I thought I'd offer that for Linda's benefit.
Yeah. Both Linda and I have POTS. Like, we have trouble being upright with our blood pressure.
Oh yeah.
Have you seen? I think seems to, as far as I understand, relate to the muscle activation and the brain inflammation, the vascular inflammation. It sounds like in theory it should help to calm it all down. So
it does have a vasodilatory effect, and it reduces people's blood pressure if they have hypertension. Now, I don't know what it's going to do with POTS. I'm not sure how you're going to react. So you're going to have to be cautious about that. I haven't seen any severe reactions. It's an annoying lightheadedness that sometimes people get with it. It usually takes about a month before that hypotensive effect occurs, but that's all right. And it may have to do with other things that you would be eating or drinking along with that, your dietary changes along with beta-caryophyllene. My wife has POTS, and she has been, I was going to say, Mr. Blatt, that my wife has POTS, and she's not affected by the BCP specifically with her blood pressure. So I'm not sure where that's going to go and what's going to happen with that. Now, I know that it actually stimulates the production of nitric oxide, which is a vasorelaxer on the blood vessels, and so that's a very positive sign. The enos is important for relaxation of the blood vessels and for the anti-inflammatory effects that you want to have with it. But I don't know what's going to happen in this case with POTS.
Yeah. Well, my guess is if I'm planning to start very low and gradually build up anyway. So I think that should be fine, because I think for my POTS at least, it has its origins in inflammation. So if it can calm down the inflammation, in theory, it should help. And like I said before, I have the inflammation in the brainstem. So yeah, I feel like it. Yeah, if anything, it should help. It should help the POTS. Interesting. Great.
So I offer 4 different products, but I'd recommend up to 3 products for you. I'd offer you the 91% tincture, and the liposomal, and then the gel.
Yeah. So just tell me again what I'm just gonna.
The tincture is a 91%. That's a pure caryophyllene that I have. I have it in a pure form. It actually has a couple of it's got rosemary and it's got terpeneol in it, but in general it's a pretty pure form, and that could be used as a vape.
Yes, yeah, I've got that written down. So I'll order a bottle of the liposomal, plus I'll get the 91% tincture as a starting point, and that should keep me going.
Okay.
So yeah, I'll send Linda and John a link to the website where they can order all the products. Great.
Okay,
Thank
if I
so
could.
much.
Okay, that's fine.
Great. Was there anything else you wanted to add?
I really want to get your results. I want to find out what happens to you, what the benefits are, or if you have any problems with it. I want to be able to dialogue with you about that.
Thank you. Yeah, I'll definitely be in touch. And yeah, if I have any, however I go, I'll let you know and get you further advice. So yeah, thank you so much. It's been fantastic.
You bet. You bet. Okay. And I'll send you the link to the webcast when I get it up.
Great. Okay. Thank you so much, Dr. Blair, and I'll John.
Thanks very much to you both. Yeah.
Thank you.
You're entirely welcome. Glad you could participate.
Yeah, thank you.